what we're dealing with a world that has advanced so much that doing the basics often gets overlooked. There are so many things that distract us. There are so many things that give us more of a short-term boost that we can often miss the smaller things and those things that are absolutely foundational for our success and for our health and for helping ourselves with ADHD.
Welcome to Season 2 of ADHD Difference. I'm your host, Julie Legg, ADHD advocate, author of The Missing Piece, a woman's guide to understanding, diagnosing and living with ADHD, and an unapologetic doer of many things. This season, we're turning up the volume with a global lineup of brilliant guests, bringing their lived experiences, insights, research, strategies and resources. And of course, along with a healthy dose of humour and humility. Whether you're neurodivergent yourself or just curious, there's something here for every curious brain. Let's dive in. Today, I'm joined by Dr. Matt Campbell, a clinical psychologist who helps people build sustainable self-care without burnout, guilt, or perfectionism. Matt's work centres on a simple but powerful idea. Most people aren't failing because they lack motivation. They're struggling because the structures they're trying to use don't match how humans actually function. Matt is the co-creator of Our Primal Five, a framework based on 5 foundational areas of health: sleep, sunlight, movement, social connection, and what we consume. Not just food, but media and substances as well. Rather than pushing people to do more, his approach helps people feel better first, so change becomes possible. Thank you for being on the show, Matt. Lovely to see you.
Thank you. Thanks for having me.
Most welcome. Today we're talking about self-care, and often it feels harder than it should, especially with ADHD. I can completely resonate with that. But when we talk about self-care, we often think about the big things. But for many ADHDers, it's very basic care that can fall away. The regular showering, brushing teeth, trimming your toenails, changing the bed sheets, for goodness sake. Why are these everyday tasks so much harder than they appear? And what's really going on beneath it, all that?
Well, I think that what we're dealing with a world that has advanced so much that doing the basics often gets overlooked. There are so many things that distract us. There are so many things that give us more of a short-term boost that we can often miss the smaller things and those things that are absolutely foundational for our success and for our health and for helping ourselves with ADHD.
So is it that there are too many other things to do and the basics fall away? Is that how it works, or is there anything else from an ADHD perspective? What else is in there that
Sure.
gives us a hard time?
Sure. Well, I think that the perspective that I take is that we have these bodies that have been around, our ancestors, we go very far back. And for our ancestors, the things that were part of their daily life, the way that what our bodies were made for, things like getting outside, moving, sleeping, being connected with others, taking in things both mentally and physically that are natural, that are from the world. These things, they had no choice to do, and that's the way our body is made. But we live in a time where there are so many things that can get us off track with these things that are absolutely foundational for our wellness, both physically, mentally, emotionally. And so with ADHD, I actually do in my practice quite frequently, I do evaluations for people with ADHD. And how often, for example, perhaps the one that comes to mind the most is sleep. How often sleep is a difficulty with ADHD. There is, it can be difficult to be organized and have structure, and we benefit from structure. I guess you'd say it's not sexy, it's not, fun, but we benefit from it. But we have these phones with us, and they're instant stimulation, and they just, they kind of suck us in, and we'll stay up and it really interrupts it. And of course, when we don't sleep, attention, these kind of things, how we handle emotions, particularly with ADHD, is hugely affected.
So many people genuinely want to feel better and even know what helps and what they're meant to do, yet struggle to stay consistent with the self care. So, from your experience, why does this gap between knowing and doing exist?
That is such a fantastic question. Because I think that when we talk about these things, even the workbook I have, it even describes it as the simple, guide for self-care. We know these things. And then when we look at the numbers in terms of how well we do at them, um, basically with each of these areas, 50% or more in general of us are struggling and are not kind of hitting the marks that we want to take care of ourselves. I think that there are a number of reasons for that. I think that first of all, as I said, there are other more exciting things to do. I think that sometimes we know what we know. We are our basis of comparison. And so we get accustomed to being sleep deprived. We get accustomed to what it feels like to have a bad diet, or be isolated, or all number of things. And so that's our normal. And so sometimes it's hard to appreciate what it might be like if we're healthy. And so I think that those are a few. I also think that sometimes we try to be too perfect. I think when we're trying to make changes, we don't give ourselves grace. We don't recognize that part of change is making mistakes. Part of change is plateauing for a bit. And so we think of that as failure, and then we stop trying. And so, trying to do too many of these things at once, perfectionism, those are the enemies of change.
We're often also told we just need more motivation. And you talk about structure being far more important. So, how would you explain the difference between motivation and structure, and why structure is what actually carries people over the time?
Absolutely. So one of the things, and when I speak with my clients about it, I really try to encourage people to recognize that if we are relying on feeling like doing something, we're in trouble. Because we may be excited about making a healthy change for a little while, but that excitement is going to wane. And when it wanes, we were relying on that to get us there. So the most, I think easy to access example of that is someone does a New Year's resolution, and I'm going to go to the gym, I'm going to get healthy. And at first they're really excited. This is going to be great. And so they hit the gym for a week or two, and maybe they're doing it after work. And then, I'm kind of tired today, just not feeling it. I'll do it tomorrow, and then it becomes tomorrow and tomorrow and tomorrow. One day slip in, maybe we slip 2 days. That's okay. That's part of it. But we're waiting to want to. And what structure provides is that routine and that habit. I give the example a lot of times that every morning I have two dogs, and I take them for a walk each morning. I don't ask myself, do I want to take them for a walk? Because the answer would usually be, this bed is very comfortable, and I'm going to take that extra 45 minutes to sleep. But instead, it's part of my structure and routine, and that's what I do. I'm not asking myself if I want to. I'm just throwing my legs down and getting to it. So the more we have a pattern and a routine, the less we have to rely on want to. Want to is hard.
Yes, enthusiasm does wane quite quickly at times.
We can also help ourselves, though, in terms of um, having our goals be a bit shorter term. And so, we're trying to make an improvement. And so, if I am trying to eat more healthily, um, I look at how many meals that I'm eating that are natural, that are not processed, and I use that as a baseline. And this week I'm trying to do a few more. I'm trying to improve it, or stay the same, and then just trying to get that momentum going. But breaking things down into shorter goals can really help us from being overwhelmed, because we know with ADHD how easy is it to get overwhelmed by especially if we have multiple goals. That's a lot. And so I think that breaking it down into parts and short-term goals is one of the ways to go.
Right. And also celebrating those small wins as, rather than waiting to the big grand goal to be completed, these little micro wins along the way.
Yes, and it's all about progress. It's all about, we're making moves forward, like you said, and not minimizing them, not minimizing improvement, because, that again, if the only time we can feel good about it is when we're at the goal that we've met it, we probably aren't going to get there, because we need to celebrate, like you said, the victories along the way, gain
Mm,
momentum.
mm. You place a lot of emphasis on foundational behaviors like sleep, sunlight, and movement. How do these
Yes.
basics support mental health in ways people tend to underestimate or overlook, perhaps?
Well, they really have profound physical and of course my field, emotional effects. A tired brain, we're going to be more irritable. It's going to be more difficult to handle feelings. Our focus, how quickly we can think, and process information is going to be greatly impacted. Our diet, if we're having, our food, the processed food is, just filled with sugars that are going to spike mood and bring energy back down very quickly. Um, and so movement and being outside, of course, that's what we're made for. But let's use movement, and of course we're addressing ADHD, but you know there are studies that indicate that exercise is as effective as an antidepressant. That's what we're made for. And so kind of lethargy, it can really lead to some really negative consequences, being isolated and so on and so forth. And, I think that and there is data out there. I believe you had a speaker, it may have been the last podcast that you had published, who was talking about the benefits of getting outside, and
Yes.
movement. And and I'm always I have a lot of clients who maybe particularly parents of children with ADHD, but also adults, and they really would like to have a non-medication option. When, of course, we know medication is effective, and a good treatment approach, but they're often looking for something. And so I try to go through the literature to give them, other possibilities, as well as noting medicine. Um, there's literature out there, exercise, that movement, just moving our body, even if it's not hitting the gym, we're moving, we're outside, and those benefits, and they benefit people with ADHD a great deal.
You touched on it before, Matt, about often having too many goals at once. And I guess that really stretches us. So many of us try to change everything, whether it be routines, habits, diets, or productivity, and then feel defeated when it all falls apart. So,
Right.
why does that approach so often backfire, especially for people already dealing with overwhelm and burnout?
Right. And so we're asking too much. It's something where we're setting ourselves up for failure by trying to do too many things at the same time. Now, one of the things that can be great sometimes is if we stack things, like in terms of the things that I talk about a lot, is stack them. So how about having, getting a routine of a walk with a friend? Okay, well now we're getting movement, we're getting time outdoors, we're getting social connection with people. So we can do things like that. But the overall is that it really helps us to kind of isolate and work at one thing at a time, because we're change is difficult. Change is difficult, and we tend to stick with with what we know. And so, for humans, we know that there's, any area of change, it requires that energy. And so we have a certain amount of energy to do this. Let's not to try to do it with everything. Let's use that energy towards this at this time. And then once we create that, some strength there, then we can go to others.
Yes, and I guess each of us as individuals have different energy cycles as well, and going with the flow and working with our brains and still having structure would be ideal, I imagine. If you're an early morning person, that probably is the
Right.
best time to structure your day around you and how you work. Whereas a set and forget, this is a great structure for everyone, might not work, in fact, for everyone based on those, yeah, energy levels.
No, again, I love that insight. We have to work with us. We have to work with what, is a clicks with us. So like for example, um, I'll often, when I'm talking to people about ADHD and I'm talking about different coping techniques and, processing and memory approaches and things like that, I'll give them suggestions and then I'll say, don't do what I'm telling you to do exactly like I'm suggesting to do it. Find what works for you. My goal is to offer you some ideas on approaches, but what's going to really help them work and be sustained is that you make them your own. As you're saying, different times of day, we have different levels of energy. And there's a lot of variability with that between people. And so what works for me is the key. Yeah, just those differences means there's no cookie cutter approach. We have to, find these things, consider these things, work on them, but do it in a way that works for us. Insofar as stacking is we're trying to things that we already do. We're trying to attach them or do them with something healthy as well. So if I like to get up and have a cup of coffee, when I wake, how about I do it on a porch? How about I do it, somewhere that I'm getting some sunlight? How about I do that? That is ideal. Morning sunlight is the ideal. It sets our circadian rhythm. It's going to help with sleep at night. Let's do that. And so, different ways of things that we're already doing, trying to add or put, connect something that's healthy for us, I like playing with my dogs. Well, is there a park nearby? Is there somewhere, that I can move around with them, things like that. So let's attach things, yeah, with our skin, with what we're already doing.
I love that. So it isn't the grandiose, I've got all of these goals and I'm going to jam them all in at the same time. We're
Right.
talking about really simple shifts here with the
And
coffee
that's
on the porch and the sunlight.
right. And it's absolutely better to do it that way and in a gradual way because they're firm up these changes and it's rather than like cramming for the test and then forgetting it afterwards, we're taking it progressively, we're adding things, we're stacking things together, and it really strengthens changes that we make.
Mm. Hence the structure, building on something already solid and just adding
Right. That's
a little bit
exactly
more.
right.
Beautiful. You're very clear that guilt and self criticism don't actually help people change. Why do those approaches make behavior change harder rather than easier?
I think it goes to something even a little bit broader. Punishment is not an effective long-term behavior management technique because we typically want to escape or avoid those things. And so as I talk about a good bit, guilt and shame are pretty toxic emotions. And they really don't emotions motivate us in some direction, and those emotions are generally unfair because we want to. My belief is that change involves empathy and understanding, and then action. You need both. And if it's criticism to kind of whip ourselves into doing something, there's a lot of negative fuel there. And we're more likely to try to escape a bad feeling rather than seek something positive. So, and the other thing that self-criticism does, it lacks understanding. Like we're not trying to understand why is this difficult for me, or why did I make these choices, or I'm sorry, punishing myself for doing that rather than figuring out, okay, what's making that difficult for me?
Mm. And self criticism, it's so easy to do, quite a knee jerk reaction that isn't well
Mhm.
thought out.
Oftentimes people are, unfortunately, they're accustomed to that. Their environments may have been that way. Maybe that's what they're so used to doing to themselves that doing something else takes some time. They're so accustomed to trying to be motivated by criticism, not failing rather than succeeding. And that's what is, to me, is health, is we're focusing on how can I succeed rather than how can I not fail.
When you strip away the aesthetics and the social media version of self care, what does sustainable self care actually look like in real life?
Yeah, so sustainable self-care, and as you said, self-care has been kind of, you mentioned social media. It's been pretty commercialized, and that's really unfortunate because that has led to people seeing self-care as indulgence. And no, it's replenishment is what it is. People get depleted by not engaging in healthy self-care. And so it is undoubtedly not self-indulgence. It's saying, okay, this is what my body needs. And I'm going to be better for myself, better for others if I do that. And so what it looks like is it looks like, as you mentioned, structure and an intentional way of living. It looks like, something where, I am kind of monitoring, I'm noticing my sleep, I'm noticing these different things, and they're more on the forefront of my mind. Um, when I slip, I notice it. But when we're not keeping it on our mind or having that idea and that thought, that's when it really can deteriorate and deplete us.
Would you be able to share more about our Primal Five? You earlier talked about the guys. Could you share more about the framework around that?
Right. And so in my work, it came to be in my work. I've done this for over 20 years now. And so I've always found it interesting to see what common issues and themes we as humans struggle with. And over time, I just wrote down so many different things that I noticed that, yeah, these are things that as humans we struggle with. And I try to come up with catchy, little phrases, to describe them. But I thought to myself, if I put together something, if I take a one shot, let me take one shot to see what would be most helpful to people. I kept coming back to our Primal Five, that the idea behind it is that so much our lives can be so improved mentally and physically if we take this structure, we recognize we're humans, our world has changed, our bodies have not. And so if I take that and so the approach with our Primal Five is weekly. So I take the first week is sunlight, then we have sleep. And so what we do in the workbook is we're trying to give the background, okay, this is why that area is important. These are the emotional and physical impacts of both doing well and struggling in these areas. And here is a way, as you and I have discussed, to try to improve it and improve it and improve it. And so we focus on each one for a week, and then we're trying to take stock. Okay, where am I on these things? And I can always go back to that workbook with the ideas. With we have behavior change ideas that are in there. I'm really big on replacement behaviors. So we're not focused on not doing something. We're finding something else that's healthy, that can fill in for where I was I had some bad habits. But that's the idea behind our Primal Five is, let's recognize these things are challenging. Yes, we know them, but there's a reason why, as I said earlier, 50% of us or more are struggling in these different areas. So it may be simple, but putting it into practice obviously isn't.
Part of it is really assessing what we consume, whether not just food, but media and
Mhm.
substances as well. Would you briefly be able to talk about the kind of issues and challenges around this consumption generation that we're living at the moment?
Yes, yes. So what the way we phrase it in the workbook is junk. Is we don't want to be consuming junk. And so we know junk food, we're familiar with that. We're familiar with, drinks and things like this that are junk. Um, but what has really accelerated at an incredibly rapid pace is the junk mentally that we're consuming. And so the areas that we focus on, the first one is the one that maybe is talked about the most is social media, and screen time, generally speaking. And so what the research shows us is that, up until we're about 18, problems start happening around when we get above 2 hours of consumption of screen time, and that's going to usually be phones and social media. When we're adults, we don't include work time. With adults, the negative effects start happening maybe after about 4 hours or so of that consumption. But it's something where there's obviously the negative effects. We know this particularly for the teenage, population and such. The comparison and the amount of time that is spent is it's mind-boggling how much time is spent because those algorithms, they know us. They're pushing our primal buttons, right? Fear, outrage, sex, different things that are very primal to us, or things that they notice that we pay attention to, and then they feed us more. And they just get that, we're hooked. We're hooked. Even when we know it is unhealthy for us because it's addictive. So, that's one. And then there's a misconception that social media is social connection. And of course, nothing can take the place of being in the room with someone. So, and sometimes, we have to use perhaps texting people, calling people. That's good. But the social media is not going to be that social connection. So there's that. Um, one thing that has, again, in the past 20 years or so, become increasingly the consumption of junk is news. Our news is just can be so toxic. The more that we consume of that news, and of course, there's very biased, one-sided news out there. So much so that you could, if you look, you can find information on what are the most fair, and kind of middle of the road, more accurate news sources. I know I did that. And so we really, what I encourage people is, at most we want about 30 minutes of news, break it 15 and 15, in the evening, or not in the evening, late afternoon and mid-morning that we can look at it. We're informed. A lot of times people are like, well, I need to take in the news because I need to be an informed citizen. You can be an informed citizen with, 15 to 30 minutes of news consumption for sure. But it really can really agitate and upset. And then of course there are these conspiracy-like extreme news sources. And then finally, one of them, that's kind of a little bit not no, well, it's not spoken about enough, but pornography. I mean, these are easily the most popular websites out there. And I don't think it's discussed enough what a negative effect that these have on people. Again, as the primal human, we're not made, just like with news, we're not made. We knew what was going on in the village around us and our village and things like that. That was our capacity for news intake.
Junk comes in many forms, and I really
It,
appreciate you explaining that today, Matt. That's very insightful.
one of my passions is ADHD. I, do a good deal or frequent assessments. Physicians will refer someone, and so what I'll do is I'll do get information and then tests of attention and symptom checklists and validity checks to make sure we're trying, and then personality, emotional functioning measures. And so I take those and what my favorite part is to talk about people, to have a feedback session and describe things and really try to explain what is happening with ADHD, how real it is, and how it's really actually quite fulfilling how often in giving feedback to people that when we talk about why we procrastinate and just waiting on the stimulation, when we talk about the difficulty in the daily management, the putting the need to before the want to, when our demands increase, and such, it's such a fulfilling thing to see someone recognize that it's not their fault, that this wasn't this bad character trait of theirs, or the biggest one is they're not lazy. It's not that they're really this is a real thing. And there really are things that we can do to help ourselves with it. And of course, with adults, and teenagers, with their parent, how often they wish they would have known sooner.
Mm.
That there were things that might not have been as difficult as they ended up being. But and it's really something with adults that for myself, I find there's generally one of two situations for an adult coming to my office. The first is someone who their some part of their life, usually their work, became a lot less stimulating and a lot less interesting. So maybe it's someone who was out doing things and they were in a group of people doing certain kinds of work, and now they're at a desk job. And that stimulation and interest just dropped off a cliff, and they're finding all of these difficulties that they may not have noticed before. And the other that I see quite often, and I tell people this all the time, I'm not sure why it is in my office that it's so often women that fall
Mm.
into this where they're very, intelligent, high achieving people, and they tend to have some anxiety, and they get to a point at which that anxiety, which kind of pushed them forward and stimulated them in that way, they're juggling so much all of a sudden that it's not working for them anymore. That anxiety isn't enough to push them or stimulate them. It's a very fulfilling thing to do evaluations and most especially feedback and talking to people about ADHD and what we can do to help ourselves.
Thank you. I love hosting this podcast because I get to talk to so many people about ADHD and their own personal journeys or their clients' journeys. And it looks so very different. But what I'm loving is the more we can talk about it, the more we can openly share this conversation, it no longer becomes a mystery. For example, the DSM, a lot of it is behavioral
Right,
uh, triggers that can be seen and observed. But it's only when you really get inside our minds and
right.
hear our feelings and our thoughts, those things that you would never see from an observational point of view. So, this feedback loop, being able to verbalize how we're feeling inside and letting the world hear that, I think is so important because that's another way to help identify or resonate with ADHD as a condition or as a difference. So the more people talk about these hidden feelings, I think is fabulous. And I'm so glad you're really enjoying that as part of your passion to actually get inside the heads of your clients.
Well, and it's it really I can't articulate enough or express enough how fulfilling that is when you can offer something to someone that helps them. As I said earlier, change, I believe, occurs through understanding and then action. Both are necessary. And so often people come in, they don't have that understanding. They don't recognize they haven't been, hasn't been taught, explained, recognized that this is what you're having trouble with. And so let's actually address that rather than, as you mentioned earlier, the self-criticism and viewing, having a narrative about ourselves, and that's really heartbreaking for me. It's really heartbreaking for me when people develop a narrative about themselves because they don't know what's actually causing those difficulties.
Mm. And the reality is, the narrative, their self narrative, is probably so far from the truth. You kind of wonder, how did they get there? But we know how we get there.
Right,
Yeah. Mm.
right, right. And I mean it's very costly not knowing. And when you see someone and they're really bright, but they really have trouble managing the demands or having to initiate more things themselves, and so they don't perform well.
Mm.
And now I'm not good at school. Now I'm not smart. These things that are just not accurate whatsoever, but we're not addressing the problem. Understanding and action.
Matt, we'll have links in the show notes to how to find you, the link to Our Primal Five, and a whole bunch of other ways to follow you and to get more involved and to hear more. So I just want to say thank you so, so much for your time today. I've very much appreciated talking about self-care and its different forms and how we can go about positive change in these small, incremental, achievable ways. So thank you so much.
I've enjoyed it.